Hello again, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and on this episode, we're joined by Jannine Purcell, who is a certified nurse practitioner in gastroenterology at Rapid City Hospital. With advanced training from South Dakota State University, leadership roles on state and national boards, and years of hospital and clinic experience, Jan now focuses on patients with inflammatory bowel disease, among others. Recognized as both South Dakota Nurse Practitioner of the Year and Nurse Educator of the Year, she brings a simple philosophy to her work: do what's right for the patient. How did I do there, Jannine?
You did very well. Thank you.
How does that feel to get recognized as Practitioner of the Year and Educator of the Year?
Well, I was surprised at both awards. To
Really?
tell you the truth, I had no idea I was going to get either. It's very rewarding, you know, and I was pleased.
I mean, it's got to feel that just has to make you feel like what you're doing has made a difference. And it's recognized, and that's got to feel nice.
Absolutely.
Well, how long have you been in this field, Jannine?
Since 2001.
Okay.
And I've been in GI since 2002.
Now, are you from here?
I hate to admit it, East River born, Yankton. I've been out in Rapid. I moved out here in 93, I believe.
Okay.
Stayed quite a while and then moved down to Texas for 6 years, and then I came back about almost 3 years ago.
So why this field? Do you have?
I never thought I would do
Really?
GI. Actually, I honestly loved cardiology because when I was a floor nurse, I did cardiology, so I thought I would never leave cards. But circumstances changed, and this opportunity came up, and within 6 months, I thought, why would I ever want to leave GI? So I have done GI because it's a vast field. You get to know patients, and there's always something new going on.
So just the medical field in general, what drew you to it when you were leaving high school and heading to college? And
well, because my mother, who is was a nurse, she's passed away now. Yeah. She told me I had wanted to be a veterinarian, and she said you should go to nursing school because you can get a job no matter where you live, no matter how big or small the town is. And so I told her I would do that, and I did, and I have not regretted it.
That's some great advice. Of course, a mom with great advice, as always. That's how it is. Well, I want to talk a little bit about, there's the subject, and we've talked about this on a couple different podcasts, specifically with Dr. Scaria, who you work very closely with.
Yes.
We've talked with Dr. Turk as well, who's another doctor who we've discussed inflammatory bowel disease. We've discussed IBS as well on this podcast. And you come in as great support for these doctors, I believe, when it comes to this, correct?
I hope so.
Well,
that's my job.
How do you specifically then, support patients with IBD and work alongside these doctors?
What typically happens is when they come into my clinic, either they have not been diagnosed yet, they get set up for procedure for diagnoses, they have a brand new diagnosis from outpatient procedure, or they've moved to the location, changed healthcare practice those types of things. So they come a variety of different venues, and when they come in to see me, it is, all right, they've been scoped, we've got a plan for the medication regimen, how do we manage, how do we follow up? And I tend to follow up patients very closely. I usually set them up to see me every 3 months, tell them if they're doing well, it's a fast in and out visit, or if the weather's bad, it's easy to cancel because we have those allotted schedule already booked out. We follow labs closely. Depending upon the medication that they're put on, they are either going to have labs every 2 months, every 3 months, give or take. Monitor that to be sure they don't develop anemia, that they do not have elevated white count, fevers, things like that, something acute going on, monitor their liver labs, monitor their kidney function, their inflammatory markers. There's several things that need to be monitored on a routine basis. There's also many things that come in with GI for education. You have to bear in mind that inflammatory bowel disease is a very young person's disease.
Really? Well, what is it really quick?
Typically, the diagnosis is between 20 35, actually. There's a lot that get diagnosed earlier than that, but in their 20s, 30s, the prime of their life, all of a sudden they've got this diagnosis that is life-changing, and it needs to be thought about for them, as well as reminding them that it is not the end of the world, that it is a bump in their pathway to life, that once we find that right drug to get them in deep remission, they almost forget day in, day out that they have inflammatory bowel disease.
Well, what is it specifically? IBD.
IBD is an inflammation. We don't exactly understand how it happens, but it's an inflammation of the mucosa of the GI tract. Ulcerative colitis is only in the colon. Crohn's disease can be anywhere from the mouth down to the anus, and so that's a little bit different, have different type of symptoms, and it waxes and wanes. The inflammation waxes and wanes, can be very severe, mild. It all depends upon the patient. Some of it is genetic, some of it is environmental, some of it we don't understand how. I will see someone who there's no family history of inflammatory bowel disease whatsoever, and then here they are.
It's the luck of the draw.
It is.
Oh, boy.
So we just don't have that figured out yet, but of course there's a lot of research on it. And when it's a young person's disease, they look at it differently because they're looking at their quality of life, they're looking at marriage, family, all of these big decisions, and it can be a burden at first. But if you kind of walk them through that, let them know that they will, once we find that right drug, get them in deep remission, they will have a very good life and be able to succeed in whatever they choose to do.
Well, what is some of the biggest challenges that these patients face then, medically and day-to-day?
Well, medically, a lot of times they present with abdominal pain, diarrhea, weakness, anemia. Those types of things interfere with their life. Can you imagine someone trying to go to college or high school and they have to run to the bathroom constantly, or even if they have a job, they've got to run to the bathroom all the time. Or they're up in the middle of the night because of bowel changes. So those are the things that they have to deal with until things get under control. Mm-hmm. And there's a lot of apps. Since it is a young person's disease, of course, there's a lot of apps and things like that out there. And there's actually an app they download, nearest bathroom to me, and it can track and will tell them where they can go, and app to track how many bowel movements they're having and those types of things. So it's...
Well, in a sense, we get frustrated, especially in the medical field. I think you guys get frustrated with people that take advice from social media, but in this case, it's working in their favor. It's helping.
It does. Actually, it does. And one conference I went to a few years ago, one of the presenting physicians, he was an IT guy, and one year they tracked how they could tell when flares were happening because of all of the IBD kids that were on their phones at night talking about their different symptoms and things. So he said, we don't even need to do a study. We just need to see who's on their phones at night chatting with each other, because there are different chat groups and things like that.
Well, see, now there's a prime example of, you can say, keep your phone with you. Keep looking at it. Go ahead. Don't put it down right away. Well, how important is to you is this team-based model of care for IBD?
You cannot manage IBD by yourself. You've got to have the physician. You've got to have the APP to guide things in the clinic. You've got to have a really robust nurse and other team members, the PharmD is huge, and that's one of the things I was going to talk about. Is one of our biggest time burners in the clinic is if we happen to have a patient whose insurance is not cooperating with the decision of what drug to put the patient on. The time you have to spend on the phone, the delays from insurance, they put you on hold, they have you talk to multiple people. It's very intensive, and we're looking at is, okay, this person needs to be on this drug as soon as possible to get them in remission so they can move on with their life. Mm-hmm. The insurance company, on the other hand, is looking at this drug is expensive and we don't really want to pay for it if we don't have to, if we can do something different or delay. So it's that is the frustrating part, and that you can't be on the phone on hold trying to talk to an insurance person who is not a medical person and try to see other patients in the clinic. So I depend upon staff a lot, depend upon the PharmD to help a lot with getting the patient on the correct medication in a timely manner.
So is IBD generally corrected with medication, or is surgery an option sometimes?
Well, with surgery, there's always risk. No one wants to go to surgery. It's much better to keep your GI tract intact. If you can manage with medication, that is the best thing. There are patients that have had to have colectomies. There are patients that have had to have small bowel surgeries because of stricturing fistulizing disease. So that is something, but it's never anything that's never first choice. That's always last option is surgery.
Okay.
If you can't control it.
Right. Do you see anything promising that's coming down the road?
There's a lot. When I started, we had a handful of meds.
Right.
And actually, it was not even mucosal healing we were looking for. It was clinical remission. They'd come into the clinic, say they were feeling good, and you thought, okay, they must be doing okay. Now, with the plethora of drugs that we have out there and the new ones that are down the track quickly to be out. It's nice. You've got multiple options. You've got biologic therapy that attacks the inflammatory markers in different areas, so they act differently. There's a lot of options. If patients happen to develop antibodies to one of the biologics, we now have that luxury of saying, okay, that's okay. There's another drug we can try you on. Let's try this one. Whereas in the past, 15 years ago, you just hoped they did not develop antibodies because there were only a few out there.
Right. So, but that has to be one of the most exciting things in your field, though, is when you get that report, you get that study, that clinical trial.
Absolutely.
You're like, oh boy.
Absolutely.
What can this do?
And you hope that it's going to work. There's sometimes you've got high expectations, and then 6 months later the drug is kind of fizzled out because the extended studies show it's not as effective as something else.
Right.
But there's some of the old tried and true drugs that still work very well, and you can't ignore those either.
Well, now does being on some of these like state and national boards too, does that influence your work in the clinic as well? Does that make a big deal?
Because I'm on the ACG, that's American College Gastroenterology Board for APPs and specifically the education, and we've developed these modules for APP learning. I spent a lot of time and effort on that, and the more you present, the more you delve into putting together presentations, the more you yourself learn.
Yeah.
And we practice, our clinic is guideline driven, and just this summer, ACG has come out with new updated guidelines, which we've needed for quite some time. Guidelines on management of Crohn's disease, guidelines on management of ulcerative colitis, and just about 10 days ago, guidelines on managing pregnancy in IBD, because that's another area that needs close monitoring.
Boy,
you didn't think about that.
You don't think about it, no.
Right.
Because there's all these life changes that can happen, especially like you said, if you're in your 20s and 30s and you want to start a family.
Exactly.
And so what are some of the complications that would go with pregnancy in IBD?
Usually, as long as their disease is under control, they do quite well.
Okay.
We watch them a little bit closer, but they do quite well. Babies are very resilient, and they typically deliver without complication.
Right.
Sometime after delivery, they may have flare, but you just don't know until they deliver.
Yeah.
So it's exciting because you see these young kids at all stages of their life. One of our patients, we got him in a nice deep remission after struggling for a while, finding that right drug for him. And when he graduated from school, he was supposed to see me that day, and he was a no-show, which was unusual for him. And then a couple hours later, he sent a message, "I totally forgot I was supposed to come. I graduated today," and I was so excited.
Well, what a great story, though, because he
Right.
wasn't even thinking about it
He
then at that
wasn't,
point.
yeah, absolutely not.
And
then one of, another patient got engaged, married, pregnant. Those are all joyful things to
You
share
get
with
to see
patients.
some of those success stories, though,
A
don't you?
lot.
So-
Most of them are
Yeah,
success stories.
right.
And it takes, just finding that right combination, that right drug that's going to work for them.
Excellent. Well, another interesting part of your bio that I saw before you came in today, that I'm curious as to how that kind of changed your trajectory too, was joining the Army Reserves. You were in the reserves, right?
I was, but that's minor to talk about. Actually, I did that because both of my children were in Iraq.
Oh,
and
okay.
they came back with stories about when their buddies would come in for physicals after they were
Yeah.
exposed to war things, that their symptoms were ignored. And there was a great
sure.
need not so much to go over to Iraq,
Right.
but it was called a backfill position where they needed someone in the States just to fill in because someone was getting deployed and
Yeah.
they had no one to manage clinic for a couple of weeks.
Were you a nurse at that time?
Nurse practitioner?
Nurse practitioner? Yeah, then as well?
Yeah.
Oh, okay.
It was kind of not an eye-opener because when I signed up, I thought I was going down to San Antonio to learn how to work the computer system for their documentation, and I ended up out on a fob, which is out in a field in a tent for 3 weeks, not knowing that was what was going to happen to me. But I survived, and it was okay.
But it still had to be an experience. I mean,
It
something
is.
that's,
Yeah, it is. Yeah.
lots of people don't, that haven't enlisted or haven't served don't really understand that.
Correct.
And that's, I just thought that was a very interesting part
Well,
of your
there were probably, and it was a big group that we were in because a lot of them are getting deployed.
Mm-hmm.
And of that group, I think there were probably about 35 of us that were older.
Mm-hmm.
And we all went in because of 9/11 or
Mm-hmm.
personal stories. And we held our own in all the PT stuff, all of the work detail, the marching. I mean, everything we held our own. And
Showed
actually,
them young kids how it was done.
exactly. So it was an eye opener and quite the experience. And I'm glad I did it.
Yeah, no kidding.
But that.
Oh, that's great. Well, you're also, I noticed on there, and we talked a little before you got in here. Now, when they're using the term master gardener, is that an actual term
is.
for what you do?
Well, it is. I went through Master Gardener education here in South Dakota.
I didn't even know
before
that
I
was a
moved.
thing.
It is. You need to check the it's by the. Your taxes pay for the
Okay.
education.
Well, I'm
for you
fine
to
with
do
that, yeah.
Yes, and you go through classes. Here in South Dakota, the classes are typically presented by the professors in Brookings.
Mm-hmm.
And then when I moved to Texas, environment's a little bit different there, so I went through the Texas Master Gardener program as well down there too.
And what does that mean?
That means that you learn specifics about plants, flowers, how to grow things. You have to, fertilizers, what grows best in what area, those types of things.
Did you have a green thumb kind of before you started this, or?
Oh, I did.
Yeah,
I love gardening,
Yeah.
and it's nice to do, and the camaraderie that you develop with master gardeners is really close. Unfortunately, since I moved back, I have not been able to maintain those meetings, and
Right.
you do volunteer work and that type of thing. I've just not been able to do that. that. And
Well, does it help? I mean, that has to be a good balance, though, because working in a field like in any medical field, any doctor or nurse practitioner, the stresses there are greater than I think in most other businesses. Of course,
they can be.
Because you're dealing in some instances with people's lives. I mean, in one way or the other. So does having a hobby like that, does that take you out of it a little?
Oh, it does.
And just help your mind go somewhere else?
Absolutely. Gardening is the best thing in the world is the best thing in the world for anyone. Yeah. Actually. Yeah.
Well,
it is.
Your pictures were amazing that you were showing me. They looked fantastic. And like I said, it was a great summer for all of it here too.
It was a good year.
How green everything stayed. Well, it has been a lot of fun talking to you, Jannine.
Well, I wanted to go back before we wind up.
Please.
I wanted to go back and kind of talk about some of the things when there's other things to follow in patients when they have inflammatory bowel disease. There's a specific vaccination regimen that is required. There I like them to see the dietitian at least once because there are certain foods, dietary restrictions sometimes, or recommendations. A lot of times they're wondering, if I ate something different, would it make a difference? And there's new things out all the time, so I like to have them referred to the dietitian at least once. They depend upon the medication that they're on and the fact that they have inflammatory bowel disease. They are a little bit higher risk for skin cancer, so recommend a head-to-toe dermatology evaluation every year.
Why does skin cancer come into this?
Because of the inflammation, the chronic inflammation. Anytime there's chronic inflammation somewhere, it's a potential.
Huh.
Right. And then always to manage and monitor when they are due for their surveillance colonoscopies for disease assessment. You've got to, there's certain regimens, depending on the age of the diagnoses, how many years out they are, what the colonoscopy found, were there polyps that need to be followed more closely. Those are all things, regiment-wise, that need to be looked at when they are followed in the clinic. And if they don't follow in the clinic closely, it's easy for those things to kind of slip through the cracks, and you don't want that. Mm-hmm. You just want to be sure that they're taking very good care of their health, that they are have the best quality of life that they can.
Right. Well, I mean, it's on the patient too. You have to understand your condition, your disease, and if you want the best outcome,
it is.
Your life's changed.
Right, right.
For sure.
And it's easy to say, well, their life's changed, but then you sit and these kids that are so young and all of a sudden things have their whole world is turned upside down, or they may have problems with their insurance, or can they change jobs and have, insurance coverage might change, those types of things that you also have to realize that they could have depression. There's a little depression score that I have them do when they come in to see me, just to monitor, make sure that they're doing okay with that.
Right.
But they're, it's just a lot. They can be complicated patients. They need to be monitored closely, but you want them to excel in life. Most of the time, I tell them that they're usually type A personality, and just stick it out and they'll be fine.
Right. And garden.
And garden. That's
that
true.
Can definitely help.
That's very true.
CNP Jannine Purcell with Monument Health Gastroenterology. Thank you very much for coming in and talking with us. And again, I hope that if any time down the road something comes up and there's any other thing that you're super interested in, that you're passionate about and want to talk about, let's do it again, okay?
Okay, sounds good.
Thank you very much.